I'm Jasmine Silas, and I'm a prosthodontist at Loyola Medicine. Prosthodontics deals with, I like to say, putting people back together or giving them back something that they've lost, from dentures, bridges, implants, crowns. I also have a subspecialty, which is maxillofacial prosthetics. I get to help patients who have like head or neck cancer or maybe cleft palates or some kind of like trauma, and I get to put them back together so that they feel more confident going out into the world. I think there are so many things that we take for granted, just like the ability to be able to go out and be understood when you're speaking, or to go out and have people not stare at you. So I think when patients go through something traumatic and they're missing their nose or their eye or their ears or a portion of their palate, and now they try to communicate with their family or just anyone, and it's really, really hard, and it's not something that a lot of people know about. So I think that just being able to give them back like that little piece restores their confidence and they're able to just feel normal again. I've actually worked in other facilities where I did not have the ability to just run upstairs or across the hall and reach the surgeon or another colleague, and it makes life harder for me, but it also makes life harder for the patient, because I think it's easier when all of their team members are able to meet in person very quickly for a meeting, so they don't have to come back and schedule extra appointments. So I think it's better for the patient, like, all around. Whether we do a bunch of treatment or just a little bit of treatment or just have a conversation to put them at ease, I want them to always want to come back.